The purpose of psychological testing is to create a definitive diagnosis of psychiatric conditions and recommendations in order to help patients identify strengths and weaknesses, other understood as self-awareness. The recommendations are used to try to make accurate findings and find treatments for patients. An individual is assessed in 4 phases. The first phase is interviews and information gathering. In this phase, patients, parents, significant others, therapists, referral consultants, psychiatrists, and other professionals are interviewed. Patients and parents are also given questionnaires to fill out information regarding medical history. The purpose is to gather information and understand the perspective of interviewees. The second phase is called psychological testing. In this phase, a series of tests are performed, such as cognitive testing, emotional testing, behavioral testing, executive functioning, and neuropsychological testing. Cognitive testing consists of IQ tests and achievement testing in order to determine the patient's strengths and weaknesses of a person's thinking. However, such tests still won't pinpoint that a person has a mental illness. Some individuals are simply bad test takers. This includes general awareness, attention, verbal comprehension, visual spatial ability, computation, abstract thought, impulsivity, problem solving, social comprehension, and judgment. Emotional testing assesses emotional functioning, depression, anxiety, obsessive/compulsive disorders, sleep disorders, and personality functioning. The behavioral testing evaluates substance abuse, trauma, self-harm, aggression, and treatment. Phase 3 consists of analysis, formulation, and written report. And Phase 4 consists of feedback to ensure accurate understanding and distribution of information. Although many may argue psychological testing and diagnosis are positives, they also portray a lot more negative outcomes as well. Anti-psychiatry is the act of promoting alternative approaches to psychiatry and is believed by many psychologists today. Before anti-psychiatry was formulated, approaches used to treat patients were inhumane. In the 19th century, Roy Porter stated how medical professions were given the responsibilities and administrating lunatic asylums. The community had full responsibility in making sure the mad were kept indoors, jailed, or confined from society. Soon after, psychiatrists were given the role in treating individuals who were thought to have psychological disorders. The individuals were studied in detail and were classified for the first time. Lesions in the brain rooted by German psychiatrist William Greisinger believed many individuals exhibited the madness. He stated that mental illnesses were brain diseases. William was an essential component in transforming the belief of labeling against people into an actual medical condition. By the 20th century, therapeutic acts were actual experimental treatments seeking for a cure by using extreme methods. The methods involved excessive bloodletting, cold water immersions, forced spinning in chairs while being strapped down, insulin shock therapy, electroconvulsive therapy, and psychosurgery. The patients were treated like testing animals and were experimented on consistently. Rather than the treatment being useful and helpful, it was more of a sign of desperation since the treatment was so inhumane and unjust. In the 1900s, people realized such treatments were not justifiable, and psychologists eventually began anti-psychiatry in the hopes of understanding schizophrenia. One of the early Scottish psychologist who discovered anti-psychiatry was Ronald D. Lang. Lang helped conclude that mental illnesses were used as labels to cover individual suffering. The reasoning behind Lang's conclusions originated from the Rosenhan experiment. David Rosenhan and 7 other individuals, including a psychologist, pediatrician, psychiatrist, painter, and housewife, went undercover. Rosenhan had made an appointment with the hospital and described to hear empty, hollow, and thud voices in his head. The psychiatrist diagnosed Rosenhan with paranoid schizophrenia and admitted him into the psychiatric ward. He then went on in being as normal as possible, in other words, being himself in the psychiatric ward. When he was asked how he was feeling, he would report back as fine. Once he was discharged from the hospital, he was given the diagnosis of a paranoid schizophrenic in remission. The institution was advised of potential imposters. However, they were never informed who would be the students and who would be actual patients. The experiment concluded that the privileged and entitled psychiatrists were pinning a label on a person rather than really finding out a clear mental problem. The students undercover were diagnosed with mental illnesses while the actual patients were called imposters. This experiment proved that physicians are more likely to diagnose a healthy person sick and a sick person healthy. But one thing is certain: any diagnostic process that lends itself too readily to massive errors of this sort cannot be a very reliable one, said Rosenhan. This is an accurate statement that many people should be aware of. So, just because somebody is diagnosed with a certain condition or disease does not indicate that a diagnostic is true. A great example is how an individual can be misdiagnosed as a schizophrenic when such symptoms are similar to a person suffering from social phobia, mood disorder, delusional disorder, and/or dementia. Misdiagnoses are serious and can truly impact individuals' lives in a negative way. Thomas Schwartz critiqued psychiatry through the book Myth of Mental Illnesses. The book was about the physiological basis for anti-psychiatry and patient advocate movements that began in the 1960s and has flourished since. Thomas argued that disease model was a category error when it came to problems in living. He saw psychiatry as an inherently coercive. The disease of homosexuality was given critique against the treatments used. He believed the involuntary hospitalizations, insanity defenses, and psychiatric control of psychiatric medications were unforgivable and wrong. Thomas' influence targeted both clinical psychiatry and psychology, hence leaving the profession with stronger emphasis on social justice and a legacy of psychiatric speculism. His major argument was that mental illness was a myth. His critique stems from the medical model for understanding human struggles and difficulties. He saw the use of diagnostic systems as incorrectly amplifying and diagnosing individuals with the presence of an actual disease. In the animal kingdom, the rule is eat or be eaten. In the human kingdom, define or be defined, quoted Thomas. In 1950, Erwin Cameron believed the brain can be reprogrammed and that he can cure schizophrenia by using brainwashing techniques. Patients were strapped into beds and forced to hear new messages repeated for 86 days in the attempt at replacing the prior memories. The experiment later concluded it was fraud and that there was no such cure for schizophrenia. The patients diagnosed with schizophrenia could have been misdiagnosed and treated inhumanely. In the 1950s through 1960s, Robert concluded electroshock therapy and aversion therapy against homosexual individuals. Homosexual desires and actions were categorized as a mental illness. Again, wrongfully misdiagnosed. Individuals were subjected to see homosexual pornography and then given electroshock therapy in order to associate pain with the desires. Then heterosexual pornography was played and there would be no electroshock therapy administered. Their treatment caused psychological damage and 1 death. Another experiment conducted was called the Monster Study. The study was intended to prove that stuttering in children is not The study proved that stuttering in children was not a genetic disposition. An experiment was conducted and led by Mary Shooter. 22 orphans were used as experiments and divided into half. Half of the children were diagnosed as stutterers, and the other half were told not to stutter. However, half of the 11 children said to have stuttering problems actually did not have that problem. The stutterers were reprimanded consistently, while the non-stutterers were given positive encouragement. The experiment concluded that the orphans developed psychological damage for the rest of their lives and that the non-stutterers eventually became stutterers due to negative feedback. These experiments are clear examples of how misdiagnosis can affect individuals. Instead of just choosing a disorder to diagnose somebody with, certain regulations and outlines need to be implemented and studied further before labeling a person. Thank you.